Behind every long hospital queue, there is a patient silently struggling. Design thinking begins when we understand people before solving problems. Today, I am going to explain the another real life design thinking case study. Imagine a patient named Ravi. He works daily to support his family. One day, he visits a government hospital for treatment. He arrives early in the morning but still waits for hours in a crowded queue. So, senior citizens, pregnant women, and emergency patients are also waiting without proper guidance. Some patients become frustrated while others leave without consultation because of long waiting times. At first, many people believed the problem was simply lack of staff. But design thinking teaches us to look deeper than assumptions. So we started with the empathy stage. We visited hospitals and observed patient experiences. We spoke with doctors, nurses, receptionists, patients, and caretakers. We asked questions like what is the most stressful part of hospital visits and what is the difficulties do patients face during the appointments? How can hospital services become easier and faster? So the answer revealed emotional pain, not just operational issues. Patients said they felt confused because there was no clear communication. Some elderly patients struggled to stand in long queues. Doctors also said overcrowding reduced consultation quality. Reception staff explained that manual appointment systems created delays and errors. One patient said getting treatment feels harder than the illness itself. That sentence completely changed our perspective. The real issue was not only waiting time, the real issue was stress, confusion, lack of digital support, and poor patient management. We also observed that some departments were overcrowded while others had fewer patients fewer patients because appointment scheduling was unbalanced. By the end of the empathy stage, we understood one important thing. After understanding user emotion, the next stage in design thinking is define and ideate. After collecting observations from patients, doctors, and hospital staff, we started analyzing the problem carefully. At first, the issue looked very broad. Long queues, delayed appointments, poor communication, and confusion were all connected. But design thinking helped us focus on one clear human centered problem statement. We defined the problem like this. So, patients need a faster and stress free hospital appointment experience so that manual systems create delays, confusion, and frustration. This statement shifted our focus from hospital operations to patient experience. Then we identified root causes using why analysis. Why patients are waiting for long hours? Because appointments are manually managed. Why is scheduling inefficient? Because there is no real time digital system. Why do patients feel confused? Because there are no proper updates or guidance. Now we entered the ideation stage where creativity becomes the center of innovation. We conducted brainstorming sessions with healthcare staff, students, and technical experts. Some suggested digital tokens, some proposed mobile appointment booking, others recommended AI based queue prediction and emergency prioritization. Every idea was written and discussed openly because during the ideation, no idea is immediately rejected. Finally, we combined the best ideas and created a smart hospital appointment management system. This solution included online appointment booking, real time queue tracking, digital token systems, emergency prioritization, and automatic patient notifications. Patients could book appointments from home. Doctors could manage schedules efficiently. Hospitals could manage patient flow more flow more effectively. The ideation stage taught us the innovation grows when people collaborate freely and focus on human needs. At the end of the define and the ideate, we transform confusion into a clear possibilities and practical solutions. An idea becomes successfully when real people can experience and improve it. That is why prototype and test are essential stages in design thinking. After finalizing the smart hospital appointment management system, we moved into a prototyping. Instead of building a full application immediately, we created a simple experimental version first. We designed sample mobile app screens for appointment booking, queue tracking, and the notification. We also created digital token mockups and a patient guidance screens. Then we developed a clickable prototype where users could simulate booking appointments and checking waiting times. The goal was not perfection, the goal was learning from users quickly. Next came the testing stage. We invited patients, doctors, nurses, and hospital staff to use the prototype and provide the honest feedback. So, elderly patients said the app need larger buttons and simpler language. Doctors requested appointment time limits to avoid the overcrowding. Receptionists suggested automatic patient reminders to reduce the missed appointments. This feedback helped us to improve the system step by step. Instead of defending the original design, we refined it based on the real experiences. That is the one of the strongest principles of design thinking. After several improvements, the system became more user friendly, practical, and efficient. Patients experienced shorter waiting times and less stress. Doctors also manage consultations more effectively. Hospital staff reduced manual workload and improved coordination. Most importantly, patients felt respected and cared for during their hospital visits. This case study proves how design thinking transforms everyday challenges into an human-centered innovations through the empathy, define, ideate, prototype, and test. Because every successful innovation begins with understanding people. Thank you for watching this video. If you like this video, subscribe and comment.